So we published in Neurology, it was a year ago, an individual patient data meta-analysis when we looked at the association between the mean systolic blood pressure at 24 hours and patient outcomes. So for this analysis, what we did, we looked at the trajectories. The trajectories means how the blood pressure scores over the 24 hours and what was the association with patient outcomes. So we're able to analyze data from almost 3,000 participants. And what we did find out is that, first of all, there are distinct trajectories. So there are patients that they stay in the low trajectory, that their blood pressure stays low through the course of the first 24 hours. There are patients that they stay somewhere in the middle, according to to our calculation, somewhere between the 120, 140. And there are the ones with persistently elevated blood pressure, which is above 150. And the last group is the minority of the patients. So in our analysis, it was less than 10% of the participants of the individual patient data meta-analysis. So we did find out that the ones that they are in the higher systolic blood pressure trajectories, they have worse outcomes. They have increased risk of intracranial bleeding and also worse functional outcome as assessed in with the 3-month MRS scores. For the disability, we find out that the ones that they are lingering in the higher blood pressure trajectories, they have a higher likelihood of worse functional outcomes. For mortality, we didn't find any statistical significant difference, but of course this could be to the limited power, and maybe we're not powered enough to show this change in mortality. So this was a separate analysis presented in one of the poster sessions. So what we did find out exactly, we analyzed the exact same data set, but at this time, except for looking at the trajectory, we looked at the variability. So the variability between the blood pressure measurements within an individual. Again, what we did find out is that when you have increased blood pressure variability, and what we did, we analyzed the data and we categorized the patients in 3 different groups: the ones that they have low variability, the ones that they have medium variability, and the ones that they have higher variability. So the ones that they were having higher variability, they had, again, worse functional outcomes and a higher likelihood of morbidity at 3-month MRS.